I'll present on the training of healthcare professional at this level, especially in HCP, and the challenges and gaps. So I'm an API connector for HCP. Just as an introduction, HCP is within central region of Malawi. That's a simple map of Malawi, and we are bordered by districts like Dowa, Salima, Kota, and Kasungu. We have 13 facilities. The population for HCP is 362, 232. That's for 2022 NSO statistics. And the Malawi, just like other countries, introduced HPV in January 2019 nationwide, but there was a pilot which was done in Zomba and Rumpi districts of Malawi from 2013 to 2018. We targeted the 9 years old. At first, the plan was to make sure we vaccinate as maybe 9 to 14 years. And the vaccination, when we are doing it, we do at 4 facility and school-based campaign. And the recommendation is at least 2 doses within the interval of 6 months, maximum of 15 months between the doses. And again, on the introduction, second year of introduction was in 2020, where more recommendation was make sure that maybe we vaccinate at least the second dose, at least a period of 6 months, 12 months. And in February 2021, Malawi introduced a routine-based vaccination, which were to vaccinate in outreach clinics, blended with vaccination in schools, to make sure that we reach as many children as possible, because most of the children who are 9 years old are in schools, and while the others, very few where we can find them at the community. So we also needed to involve the community by engagement of local and influential leaders who can help us in mobilization. And by that one, we are able to reach as many as we can, and also community sensitization. Now, on the training of healthcare professional at the district level, and HCP in particular, training of healthcare professional included different cadres at the district level. We include nurses, clinicians, and health surveillance assistants. And in Malawi, health surveillance assistants are one who actually mostly involved in immunization. We also included maybe at school level, in this case, we also included school health and nutrition teachers and head teachers, because they are custodian of the learners in primary school where we do vaccination. So the training also now proceeded by mapping of 9 years old at school level and community, so that we see how many do we need to vaccinate as much as possible, so that we can reach as many children as possible. And some of the gaps which are seen at this level, that not all health workers are trained, especially nurses and clinicians, because maybe of constants with budgets and others, and also staff turnovers as years pass by. When you start, you find maybe when we started in 2018, we started with a elite number of staffs. Maybe you see in the next slide, which is explaining more about the staff turnover. And maybe also eligibility determination as a challenge, where there was no any reliable data sources, especially when we look at the school registers and also maybe information on birth dates. Although some information which on birth date, where we got some information from the parents to make sure that we know who is more eligible to take part in the vaccination, especially the 9 years old. And we also realized there's some also training gaps, especially in curriculum, in nursing schools, and also other professionals where they are doing some training, especially at schools, where mostly immunization new trends in immunization, including HPV vaccination, are not incorporated in the training curriculum. And this is just a glimpse of maybe staff turnover. When we started in 2019, for example, HSAs, we had as a district, we started with 165 HSAs, but the number has been increasing with years, where in 2022, we're at 203. So we trained all HSAs, but we not train all nurses and clinicians. And for example, also the number of nurse clinicians also have changed. But if you look at maybe the number of HSAs who are the most custodian of immunization services in Malawi, you may discover that maybe not all 165 are the is number which is found in 203, especially when we look at 2022. So you see there's been a step turnover with time from 2019 when we started, and as we are now in the year 2022. And maybe some of the lessons learned, we really need to have adequate training given at an appropriate time with life support are necessary for proper mapping of eligible children. And in this case, we're looking at the 9-year-old girls. We also need to have maybe refresher trainings and ongoing mentorship to make sure that maybe as we have staff turnover with time, we need to increase knowledge gap and to help as the staff changes with years. And we need to embrace routine vaccination and with good collaboration of stakeholders, especially education, because education, that's where the students are, and also the community. And as a way forward, we need to have inclusion of immunization and HPV vaccination curriculum in schools, need for ongoing mentorship, proper planning, especially for mapping of eligible children, the girls, and the routine vaccination have found to be now the most one which we are using in Malawi. In this case, we need to have that good collaborations. Otherwise, thank you very much. But I have some of these pictures just to see what happens when immunization. This is the before immunization. The girls need also to be educated on what happens, why they need to do vaccinations. So the one in blue here, it's an HSA trying to educate our girls what's going to happen in vaccination. And another one is now a vaccination process. And finally, the two pictures are now celebration. The girls celebrating that they're vaccinated. You see, they can show their cards that now we are vaccinated. So they're happy with the vaccination process. That's all about my presentation.